started.
Okay. I'm Sam Dorsey, and I give permission to be filmed. Come in.
Hello, Mr. Dorsey. My name is Marissa. I'm going to be your student nurse today. I'm just going to perform some hand hygiene before we start. And I understand we're here for a health assessment today. Is that correct?
Yep.
All right. Before I begin, can you please state your full name
Sam Dorsey,
and your date of birth?
9997,
All right. And what is today's date?
May 14th, 2020.
And where are we right now?
At your house.
Good. All right. So first thing I want to do is I want to check your vital signs. So I'm going to start with your pulses. Can I see your wrist? Thank you. This one's bounding more. So I'm going to do this one, and I'm going to count for 30 seconds, starting now. Still checking your pulse. Good. All right. So you got or counted 18 for your respiration rate, and I was doing that without you knowing, so you didn't change your respiration rate. And then I also got 70 for your pulse, which is normal, so that's good. Next, I want to do some blood pressure. So, is there any reason I can't take blood pressure in either arm?
No.
All right. Which arm do you prefer?
Left.
Okay. So I'm gonna elevate it here. Thank you. And I'm gonna have to do it twice. So, can you sit up for me? Okay. Is that too tight?
Yep.
Okay. Okay, so I'm doing it twice because first I want to estimate it, and then I can actually take your blood pressure. So you can breathe normal for me. You're gonna feel some pressure. Let me just find your pulse. I felt it obliterate at 130, so I'm gonna pump it up to 160 this time. So same thing, you're just gonna feel some pressure, right? So it was around 130 over 80. next I want to examine your head. Can you please take off your hat for me? All right, thank you. Can you come this way? Thank you. So I'm palpating for pain or tenderness. Do you feel any pain or tenderness? Okay. No abnormal bumps or lesions. Normal hair distribution. All right, thank you. You can put back your hat on. All right. And can you look upwards for me? Thank you. Looking at your conjunctiva and sclera, look normal. Good. All right. So now I'm gonna shine a light in your eye.
Okay.
And I want you to look over my shoulder this way. All right. Look over my shoulder. Thank you. Look over my other shoulder. Good. Your pupils are round and reactive to light. Now I want you to follow this pen with your eyes, not your head. Good. All right. And can you smile for me? And puff your cheeks. Good. All right. So I need to look up your nose. So can you tilt your head back? Good. Your nasal septum is intact, midline, no perforations. I'm gonna look in your mouth. Can you open your mouth for me? And stick out your tongue and say ah.
Ah.
Good. Okay. Your buccal mucosa is pink and intact. And your uvula rises with phonation. So that's normal. That's good. Yeah. So we're gonna do some movements. Can you raise your arms above your head? Back down to your side? Good. Can you shrug your shoulders for me? And don't let me push down. Good. Squeeze my fingers. Good. Good, great. Alright, now I want you to touch every finger to your thumb and go back and do the same. And that was not difficult for you?
No.
Good. Alright, so that looks normal. Next I want to look at your back. So I'm going to stand over here. And can you face your back towards me? Okay. So, I'm going to have to lift up your shirt. Is that okay?
Yep.
Alright. And I'm going to palpate for pain or tenderness. None?
No.
Okay. Skin looks normal. Good. You have some growth or stretch marks, striae, and that's on your spine. So from just your growth spurts, it's normal. All right. And I didn't feel any crepitus, which is good. So every time my hands touch your back, I want you to say 99.
Okay. 99. 99. 99. 99.
Good. And that was checking for fremitus, and it decreased as I went down, which is normal. It's the vibrations when you speak. All right. So now I'm going to go ahead and start listening to your breath sounds. So for these breath sounds, I'm going to have you inhale and exhale deeply through your mouth, not your nose. And let me know if at any point you feel dizzy or lightheaded. Okay. Can you lift up your right arm for me? And I'm going to listen to your breath sounds on your right side. So same thing, deep breaths in and out through your mouth, not through your nose. so now can you face the camera? So I'm gonna look at your anterior chest. And I'm gonna have to lift up your shirt. I'm gonna palpate. For any pain or tenderness, let me know.
Nope.
None?
Nope.
Okay. And I didn't feel any crepitus, which is good. I need to check for fremitus. Sorry. So again, every time you feel my hands touch you, you say 99.
Okay.
Alright.
99. 99. 99.
Alright. And breath sounds. So, same thing, I'm just listening to your breath sounds, but on your anterior thorax. And take a deep breath in through your mouth, out through your mouth, not through your nose. Let me know if you feel dizzy or lightheaded. Alright, thank you. Everything sounds normal. Next, I want you to lie back at a 45-degree angle. I have another pillow over here. Your head this way. Alright, so I'm looking for jugular vein distension. So can you turn your head to the wall? Good. And I'm looking for a distended jugular vein, which you don't have. Good. Face your head towards me. And it all looks good over there too. Alright, so now I'm going to take the pillows away. So you're lying flat on your back. Alright, so we're going to be lying down for the rest of the examination. We're going to go to your heart sound, so can you lift up your shirt?
Yep.
Alright. So you can breathe normally for this. And I'm just going to check in all 4 spots with the diaphragm, my stethoscope first. So I'm listening at your aortic, pulmonic, tricuspid, and your mitral. Good. Alright. Now I'm using the bell on my stethoscope. I'm going to go back at the mitral, tricuspid, pulmonic, aortic. Good. Alright. So now I'm going to do, I'm going to listen at your carotid arteries with the bell of my stethoscope. We can often hear, bruise at your carotid artery, which we wouldn't want. It would mean turbulent blood flow. So can you turn your head toward the wall? And for these, I need you to inhale and then exhale. And when you exhale, hold your exhale, and that's when I'll listen, okay? So when you're ready, go ahead. Okay, hold your exhale. And I'm listening at the 3 carotid spots. Good, go ahead, breathe normally for me. Same thing, turn your heads towards me. Inhale and hold your exhale when you're ready. Hold the exhale. So everything sounds normal. I'm gonna go next to your abdomen. So I'm gonna lift up your shirt. I'm sorry. And first, I want to inspect your abdomen. Your umbilicus is midline, which is normal. That's good. Skin's a little paler, which is normal because your abdomen gets the least amount of sun. I'm looking at the contour from the side. It's pretty flat. And now I'm going to listen to your bowel movements. And I have to listen in all 4 quadrants. So I'm going to start down here at your right lower quadrant. You can breathe normally. Right upper quadrant. Left upper quadrant. Left lower quadrant. Good. All right. So now I'm going to percuss in all 4 quadrants. And now I want to percuss from the umbilicus to your pubis, and that's percussing your bladder. Good. And I just have to palpate as well. So let me know if you feel any pain or tenderness. I'm going to start down here, your right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. You didn't feel any pain?
Nope.
Good. That's normal. Alright, so now I want to look at your arm, sorry. I'm looking at the texture, hair distribution, skin color, temperature. Other arm. Texture, skin color, hair distribution, temperature. Good. Alright, so now I want to do your capillary refill. Just pressing down at each nail bed. Good. All 10 digits are less than 3 seconds, which is normal. That's what we want. You have good peripheral blood flow. Can I see your wrists? Both of them? Alright. So I'm looking here. Your radial pulses are bounding bilaterally at the same time, same rate, so that's normal, that's good. And let me just look at your skin turgor. So I'm going to pinch here. Good. Good. So your skin recoils normally, and it has good elasticity. That's good. Next, we're going to go to your legs. We're going to start with some movement. So for your left leg first, can you please raise it? Bend at the knee, come back, and lower it. Right leg, do the same thing. So raise up, bend at the knee, back, and lower it. Good. So now I'm just gonna look at your skin on your legs. Looks normal. Hair distribution normal. Color looks normal. No abnormal bruises, scratches, lesions. I'm gonna palpate. Let me know. Do you feel any pain or tenderness?
Nope.
Okay. This side, any pain or tenderness? All right. And I want to push against your feet. Push down like you're pushing on a pedal. Good strength. And both sides. I'm gonna move your foot over here, and I'm gonna palpate your pedal pulses bilaterally, which is at the top of your foot. Good, and they're bounding bilaterally. Posterior tibial pulses, which is under your tibia. next, I want to test for sensation. So I'm going to touch either leg, and you're going to raise the same side arm for which one I'm touching. So close your eyes. Keep them closed. Okay, one more time. Good, thank you. You can open your eyes, and last thing I want to do for your legs is look at edema around your ankles, which you don't have, which is good. All right. Can you please turn your body so you're facing the wall? All right, so I'm just gonna palpate for pain or tenderness. Let me know. Do you feel any pain or tenderness back here?
Nope.
Good?
Yep.
All right, thank you. You can sit up now. And do you have any questions for me before I go? No? Okay, thank you.